Okay, today we'll have a clinical discussion on varicose veins. Do you have any clinical scenario to be presented?
Yes, sir.
Okay, then you start off.
Good evening, everyone. Here to present a case of varicose veins. A 59-year-old male who's a shopkeeper by occupation from Kattupakam, Chennai, has come with the chief complaints of swelling along the course of his veins on both the limbs, with right greater than left, from the past 1 year. And he also has pain over both lower limbs from the past 1 year. And he's also complaining of an ulcer on his right leg from the past 5 months.
Okay, right. So what is the significance of age?
As-
Varicose veins. Can you define varicose veins?
Varicose can be stated as dilated and tortuous veins, superficial
So
veins.
you can add 4 adjectives to it. Dilated, tortuous, distended, elongated veins.
Yes, sir.
Okay, are called varicose veins. Okay. So what is the importance of age? So mostly younger patients get primary varicose veins. Okay, the middle-aged and older patients get secondary varicose veins. Okay, and what is the importance of occupation?
Because based on the occupation, there can be who stand for a long duration in the day, they are more prone for getting varicose veins, sir.
Yeah, so standing for long hours, okay, increases the venous pressure, and the standing idle is more important than the walking and other things. Okay.
Yes.
So that's an important thing. So people who are even we like neurosurgeons and doctors who stand and operate for many hours, right? They are prone for varicose veins. Okay, that's important thing, right? See, many will have how to present, because patient will tell narambu vingi irukku and all, right? So you won't be knowing how to present. Like you say, like patient is complaining of multiple tortuous swellings
Okay, sir.
over the lower limbs.
Yes.
That will be a better term, like tortuous swellings along the course of veins. How do you know course of veins? You have to tell from the patient's own term, right?
Yes.
So it's better to tell patient is complaining of multiple tortuous swellings, okay, in the right or left lower limb,
Okay,
right?
sir.
Since 1 year, right?
Yes, sir.
And pain both the lower limbs since 1 year, and ulcer since 5 years. Okay, now history of presenting illness.
So moving forward to the history of present illness, patient was apparently asymptomatic 1 year back when he noticed multiple swellings along both lower limbs, with right greater than left, with near the ankle, which was insidious in onset and gradually progressed up towards his thigh.
Very good. It's important where he first noticed. See, if he finds tortuous veins, okay, first in the lower limb, that is in the leg, gradually ascending up, maybe the pathology is SFJ and everything, right?
Yes,
So if he sees at a given time, right, the veins that are dilated throughout the lower limb, probably SFJ junction is incompetent.
Yes.
If he sees only in the lower limb, then ascending up, likely to be a perforated incompetence that is ascending up.
Okay.
Okay. So where did he notice? How it appeared initially? It will be distended, but it become more distended as the day goes by.
Yes.
As the days goes by, right? So you have to exactly tell, right? Dilated veins.
So the dilated veins get more prominent on prolonged standing and towards the end of the day, and get relieved on lying down. So he's also complaining of dull aching, continuous pain over both the limbs, lower limbs, from the past 1 year, which is insidious in onset and gradually progressive in intensity, aggravated on prolonged standing and more towards the end of the day, which is relieved by lying down.
Yeah, fine. So this is important, right? What are the types of pain varicose vein patients will get? Most often they get this dull aching pain when they stand for long hours. You are right. Okay. At times they can get pain due to thrombophlebitis. They'll have pain along the veins, right? At times they can get pain due to an ulcer, you said, cellulitis. So they'll have pain around the ulcer. Okay. So you have to be very clear. And pain most often relieved not only on lying down and elevating the limb.
Yes.
Okay. So you should know what you mean by this type of pain. Venous pain, right? Venous pain occurs more so, and night cramps is again an important symptom. They get night cramps. That's why they get used to elevate the lower limb, and this because of increased venous pressure.
Yes.
Okay, they'll get the night cramps. So there is no history of night cramps.
No history of night cramps or no history of pain aggravating on walking, sir.
Okay.
There is a history
So which pain will aggravate on walking?
arterial disease.
Arterial disease, yeah. You have to rule out from arterial claudication.
Yes,
That's
sir.
right. In a varicose vein, if there is periosteitis, okay, they can have pain while walking.
Okay.
Right? Okay. So you should know under the ulcer there can be periosteitis that can again aggravated while walking, right?
There is a history of skin discoloration on both the legs near the ankle from 1 year. And he's also complaining of a non-healing ulcer over the inner aspect of the right leg near the ankle following a trauma sustained 5 months back, and which is associated with dull aching type of pain. It is not associated with bleeding or any discharge from the ulcer.
So better to tell there is a ulcer instead of telling non-healing. How will you know whether it's healing or non-healing? Only on examination. Patient words you may not know, right? So you can also just tell there is ulcer over the inner aspect of the right leg near the ankle, right?
Okay.
So you should know why you get skin changes, okay, and ulcers around the ankle. Why?
Because of the chronic venous hypertension which the patient is having in that area, and that area is also having more of direct perforators rather than indirect perforators because of the less muscle density.
So while you're going for inspection, we'll discuss in depth about it.
Yes, sir.
Okay, right?